How are you doing? Are you in for a ENT exam today? Great, I thought it might be you. So to begin with, I'm just going to check a few of your details and then we'll get straight into it. Yeah? Okay. So firstly, what is your name? Okay, and what is your date of birth? And what is your current address, please? And a postcode? Brilliant. And do you have any allergies? Okay. That's fine, that won't be an issue today. And what medication are you on at the moment, if any? Okay, I think that's all the questions I have for now, but I probably will ask you as we go along some, just to kind of find out little bits and bobs. Is that okay? Great. I will be coming in quite close to you today, is that okay? Perfect, thank you. Just the nature of the exam, really. So I'm going to pop on my gloves first. And the other one. Yes, these are latex free, so I know you mentioned that you had a latex allergy, so no problem at all. Just got these ones here. Okay, so first of all, I'm just going to have a little bit of a feel around your face, just to check for any lumps, bumps, anything swollen or red, anything like that, okay? So let's start with your forehead. Just kind of give it a rub and a pat down to your cheeks. Okay, and under your jaw, so the other side as well. And your other cheek. Pat. And your head. Okay. So how come you came in for an exam today? Is it just a general checkup or have you got any concerns? Okay. You've had a bit of a cold recently. Okay, that is absolutely fine. Yeah, the ears, nose and throat can be quite, have a lot of symptoms when you have a cold and can be kind of a pain and have some discomforts during a cold, so it is a good job that you booked this exam. Okay, so first I'm going to have a look into your nose. I'm just going to have a look in with my torch, is that okay? Yep, just check for any kind of extra mucus or anything like that. I can see that you've got quite a lot of mucus up there, and all those kind of things that you don't really want. So I'm just going to use some decongestant spray just to kind of clear it out. Yeah, just like those kind of nose sprays that you get from just normal pharmacies. Is that okay? Yeah, I'm just going to close your eyes for you and just spray. Oh, this is supposed to be a new one. Perfect. And then just kind of wipe it away, any excess. There we go. Take another look. just going to run a few tests if that's fine. So I'm just going to squeeze one nostril and I want you to breathe out the other. Yeah, so just keep breathing, keep breathing. Perfect. And we'll try that with the other nostril. Keep breathing, keep breathing. Perfect. Don't seem to have any of these, so I'll just try these. So I'm just going to ask you if you could please give this a smell, just to check that your sense is all working fine. But I am going to have to close your eyes again, so could you tell me what this is, please? What was that one, please? Lemon. Perfect. Okay, that looks all to be fine. I'm just checking my notes here at the side just to make sure I'm not missing anything. ENT exams are pretty rare nowadays, but you don't have any blockages. We've just got that out with the decongestant spray and it all kind of came out. Your breathing seems fine out of both of your nostrils, and you seem to be picking up smells. You seem to be picking up smells quite well. So yeah, all looks good. I will have one final check with my otoscope though, just to make sure, just for anything deeper that can't be seen just with my own eye. Is that okay? Brilliant. Let's just have a look. Okay, come a bit closer. Okay. Perfect. No, just the same as what I could see with my own eye. Nothing to worry about. Like I said though, you are obviously quite blocked up as we had to use a decongestant spray, but that's just normal for things like a cold. Yeah. I will now look at your sinuses. Just take a feel, because I know that a lot of people do get blocked up sinuses when they have a cold, me included, and it can affect their hearing and just generally just kind of that bunged up feeling. Yeah, it's not so nice, is it? No. So I'm just gonna kind of take a feel, make sure it's not too bad. Obviously you will still be affected, but you don't want it to be too much. They are feeling quite blocked up, but no more than usual for someone with a cold. Okay. Perfect. No, that all looks to be fine. Like I said, normal for a cold, but it should just naturally come down. If not, then you can just easily get some tablets over the counter at pharmacy. Yeah. Okay. Next, we'll move on to your mouth. Yep. I'm just gonna if you just open your mouth for me and say ah. Brilliant. Keep it open. Okay, I'm just checking for anything unusual. Your throat does look quite dry, but as I said, normal for a cold. Yeah, just keep taking kind of soothers and other kind of cough sweets and it should go down. It does look quite inflamed, the back of the throat, quite red, but normal for a cold. Yeah. Okay, I'm just going to take a look with the light just to make sure I'm not missing anything. Perfect. Nothing there. Could you give me a cough, please? Yeah, just cough. Perfect. And I want you to go like this. Yeah, just poke it out as far as you can. Brilliant. And then I want you to just have a quick swallow and I'm going to feel your neck. Yeah, so swallow. Swallow again. Swallow again. sorry, this must be really uncomfortable. Perfect, thank you so much. I know that's really not the most pleasant thing to do, but it's got to be done, unfortunately. I'm just going to type up a couple of notes here, just to mark about what's been going on. Didn't see anything there. Sinus is slightly swollen, but nothing too extreme. Okay, I guess now we move on to your ears. Is that okay? Perfect. So if you just put your hair back, please, behind your ears. Brilliant. So I'm going to look inside with my otoscope first, make sure I can't see any wax buildup, anything like that. Yeah. Do you clean your ears very often? Yeah. And what do you use? Do you use cotton buds? Any drops? Okay. Yeah, cotton buds are not suggested, but I know that a lot of people tend to do it anyway. And when you're using cotton buds, please just stick to the outside of the ear, because you don't want to push any wax down any further, because that can kind of cause hearing loss and other things that you don't really want. Yeah, and a lot of people don't like to do that. Okay, let's have a quick look. You do have a little bit of wax, but that's completely normal. Wax is there to prevent any unwanted bits going in your ears. Yeah. Okay, and I'm just gonna... Oops. There we go. Look on the other side. Same on this ear, a little bit of wax build-up, but nothing too horrific. Yeah, your ears don't feel like that inflamed, and I can't spot any redness, but I will just have a little check. Look under the lobe. Yeah, look under the other lobe. Perfect. Just kind of feel them a little bit. Haven't got any spots or anything like that, so that's really good. Just make a note of that. Okay, but you do have a little bit of wax buildup, like I mentioned. Would you like any ear cleaning done today? I think I've got time on my schedule. Let me just have a look. Yep, I have. Yeah, that's absolutely no problem. I will be just using some spray just to clear the build-up, and it should just all fall straight out, but I will be kind of cleaning with a cotton bud just to empty it out. Yep. So let's have a look. Which ear first? Okay, let's try with the left ear. So I'm just going to kind of protect your face. We don't want any of it in there. Okay, and then the other side. Perfect, it looks like it's gone in fine. Yeah, now we just let it sit for a couple of minutes. Yeah. Let me just check if I'm missing anything else. I don't think so. Just ear cleaning, and then just checking that your ears are sensitive to sound, how sensitive they are to sound. Have you had any problems with me coming in too close, or not being able to hear me, or kind of any sound that might kind of like a ringing sound that might, you know, be uncomfortable? Have you had any of that today or recently? No, that's good. Yeah, just trying to stick away from loud music, really. No, loud, like uncomfortable and hearing loss can be caused by many things. Yeah. So hopefully it should be done. Let me just have a quick look again, make sure that everything, just checking it's kind of all working as it should be. Yeah. And the other side. Yeah, really good. Okay, I've got my box full of cotton buds in here. Brilliant. So just put them down there. And I'm just going to go in and kind of pick out what I can see, and then we'll use a scraping tool if we can see anything in there further. Okay? Perfect. Is that okay? It's not affecting your hearing or uncomfortable, is it? Perfect. Put it in the dish over here. Okay, I'm just going to have a quick check for anything deeper that might have fallen or anything like that. Looking a lot clearer. Okay, and the other side. Great. Honestly, looks like there's no problems. I'm just going to collect the bits that have kind of come up here. That is quite common. And the other side. Perfect. That seems to all have cleared now. Okay, so now that the ear cleaning part has gone, I am going to come in close and whisper words from ear to ear, just to check your hearing, make sure that anything kind of doesn't feel hurt, feel uncomfortable, and that you can pick up everything I'm saying, okay? Yeah, it shouldn't take too long. Okay. 7, 7. Perfect. Tissue, tissue. Great. Photo, photo. Brilliant. Spray bottle, spray bottle. Perfect. Coffee, coffee. Cool. And last one. Light bulb, light bulb. Light bulb, perfect. Okay, no problems there. I'm now going to want you to close your eyes. Close them, close them. Great, and I'm going to click in either side of your ear, and I want you to tell me first of all which ear I've clicked in, and second of all how many clicks. Perfect. Brilliant. Great. Yep. 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 Perfect. Yep. Perfect. No problems there. Let me just update my database. Perfect. Let's just pull up these set of, just like more like a checklist. Yep. Right. I think we're actually done. Yeah. I think next I'm going to take your heart rate just to make sure. You said that you had a cold, and I just want to double check that your heart is and your lungs are acting the same and have not been affected by this. So yeah, let's just try that. If I can get this out of my hair, that would be great. There we go. Okay, so I'm gonna come in and just feel your heart rate. Yeah, thank you for lifting your top. Okay, so 3, 2, 1, breathe in. And breathe out. Okay, and breathe in. And breathe out. Perfect. Yeah, no problems there whatsoever. Heart rate seems pretty steady, and yeah, nothing different from normal. Okay, so I am just going to take a quick look at your sinuses again, just because I want to make sure that they are not too inflamed. Yeah. Are you having any trouble with them? Are you feeling really blocked up? Are you feeling kind of like you might start having hearing loss because of the sinuses? Yeah. Then I would fully suggest going to the pharmacy and picking up some just normal tablets. Yeah, we don't prescribe them here just because they're so easy to get hold of. Yeah, but if you have any more problems, or it doesn't go away, or it gets worse, then please feel free to come back. Happy to have another look. Yeah, and we can kind of update my suggestions going forward if it doesn't go away quickly. But as you said, it's a common cold. I would suggest it would go fairly soon, within the next couple of weeks. Yeah. If there's nothing else, then you're free to go. Hopefully I see you soon and your cold gets better. Yeah, we don't want any of those symptoms worsening, do we? No. So I hope that you have a good rest of your day, and see you soon. Bye.